Hi, I'm Karen Reams. I am a pulmonary hypertension patient. What led to my diagnosis was I had been noticing for years that I was short of breath. I was a smoker, so of course, you smoke, you're going to be short of breath. Well, it just kept eventually getting worse and worse, so I quit smoking, and it didn't get any better, and I thought, okay, now time to tell my doctor. So I told my general practitioner that, I'm getting short of breath. He said, all right, we got to get you to a cardiologist. Went to a cardiologist, ran some tests, did an echo, said the echo didn't look good, put me in for a heart catheterization. And while I was in there, he noticed that the pressures in my lungs were high. So he went and got a pulmonologist from the hospital to come in to the room where I was getting the heart cath to diagnose the pulmonary hypertension. And they said, yes, you do have pulmonary hypertension. Well, of course, I know nothing about that, what it is. Unfortunately, when I was diagnosed then, I went to see that pulmonologist after the test. And I said, so what is pulmonary hypertension? And he said, well, it's a rare lung disease. And in the past, when you were told you had pulmonary hypertension, the next thing we did was called hospice. Well, that's all I heard. I immediately freaked out, didn't hear anything else he said, scheduled more tests, and left his office, went home, went directly to the internet and started looking up pulmonary hypertension, freaking out, thinking I need to talk to someone who has this. So I found support groups right away. Went to the support groups, said, I just diagnosed. And they said, you need to find a pulmonologist who specializes in PH. So I had done that. So I chose one, and I now go to a PH specialist. She did her own heart cath. The pressures were very high, and they put me in the hospital right away, and I went on Veletri, the IV therapy. A lot of anxiety going on a IV therapy medication, but once I got used to it and got used to the new lifestyle, things got better, my breathing got better, but then it was within 3 months, because that was in October of 2015. In February of 2016, my breathing got worse. I was up to 6 liters of continuous oxygen and went back to see my PH specialist. And she says, we need to run some more tests. And she said, have you ever had a VQ scan? And I had at the first round, and they said there was nothing there. Well, she said, we need to run a VQ scan. So they did, and they found a lot of clots. So I am a CTEPH patient. So then I get told the wonderful story of finding a cure. There's a cure for CTEPH patients, so I'm very fortunate that I have CTEPH. So my doctor sends me to San Diego for the PTE surgery, and I'm all prepared to be cured and have a PTE surgery. And when I go there and get evaluated, I am not a candidate. My blood clots are too distal. So devastated, absolutely devastated. But they said there is a procedure that we can do, and it's BPA, balloon pulmonary angioplasty. And we do them in increments, and they feel that those would really help me. So I said okay to that. I have had 6 BPA procedures over a period of 1 year. 3 different times I traveled to San Diego. And my breathing did get a lot better. And then they put me on a Dempus, and I got better. I still wear oxygen. It's hard to breathe when I move around. I can't walk very long distances. I have an absolutely new normal. There is hope of being able to travel. I just went to Alaska on a cruise with oxygen and a scooter. So there is life after PH. So I have gone through a lot of ups and downs with the anxiety and the depression and then the hope of finding the cure and devastation. And through it all, I just have a lot of family support. I have a lot of support on the groups online, the support groups. And in the end, I just think God has given me this because He knows I'm strong and I can handle it. So I'm here to prove to Him that I am strong and I can handle it. The advice I would have for somebody that would be diagnosed with PH is to find a support group. Find people that you can speak to that know what you're going through. Believe them when they say there's hope, and cry with them. They will cry with you. Just find the support because, as I said, there is life with a PH diagnosis. I'm Karen Reams, and I'm aware that I'm rare.